Good morning, good afternoon, rather, to everybody who is on the line today. Thank you to all of our City of Birmingham employees who have joined us. Thank you for the service you provide to our city. We will now begin our call. Just a reminder to folks, this may be your first time joining us, or you've been on before, just to kind of give you an idea on what we will be doing here. Momentarily, in just a moment, the mayor will provide some opening comments. We have a number of people who can provide answers to questions. If you have a question during this call, press 7 on your dial pad. Press 7, and our screeners will connect with you immediately. They'll take your question. We'll put it into the monitor so that we can respond to your question. We will get to as many questions as possible during this time we have together. We will also ask you some questions to get a snapshot of where you are in this particular time with the pandemic and the stay-at-home ordinance that's in place. We will give you more details on how to respond to that in just a moment. But to begin this call, I would like to turn now to Mayor Randall Woodfin for opening comments.
Hey, good afternoon to our city employees, everyone. This is Mayor Woodfin. I want to thank you all for being on this call. I want to thank you for spending some time with us for our Tele-Town hall. You know, we are in our 6th week of this crisis, and so many of you all have been personally affected. I am aware of employees whose family members have tested positive. I'm also aware of, unfortunately, some employees' family members have passed away due to the coronavirus, and so I just want to take the time to let those employees know who have family members who have either been sick or have transitioned because of the COVID-19. My thoughts are with you. I am extremely sad for you that you're going through this, but we are all in this together. And I know this has been wearing on many of us. Some of us need haircuts. Maybe all of us need haircuts. A lot of us miss our parents, and like me, have to stand in the yard to talk to some loved ones and not be able to go into their home. But what you all are doing is important in keeping our city moving. Our residents are very appreciative of that. I know that because they send me emails, they send texts, they call our office to let us know that they're appreciative of the work that many of you all are doing out there. So thank you for continuing to put people first. In addition to that, we maintain our modified operation schedule for our public works to reduce their exposure to people, and we've given them an extra day to recover from the heavier workloads, especially due to residential waste being higher than usual. Just some other notes. We're also still doing our deep cleaning of public spaces every weekend and have stepped up routine cleaning in all of our buildings to make sure that there's less potential for exposure. You know what we do on these calls, and that is to answer questions. So before I turn it over to Rick to guide us through the process of Q&A, I want to make a couple notes. One note is hazard pay. The hazard pay period will begin next pay period. And then the other note is about the cost of living adjustment. I want to start off by being very direct and apologizing to our employees. When I made mention of the COLA and the council passed it, I was under the thought that it can be for the entire year. But we found some state law, and that law has been shared with the Human Resources Department that doesn't allow it to be retroactive. It can only be for when it's enacted. In the case, this was passed in March. So with March only having 4 more months remaining in the fiscal year, this COLA can only be 4/12 of your cost of living adjustment due to the state law. The state law, I'm not going to necessarily read it, the whole thing, but in part it says legislators should have no power to grant or authorize or require any city the power to grant extra compensation after services have been rendered. Because those services were rendered between July 1 of 19 to February, I can't go back and give you cost of living adjustment for then. I can only give you going forward. So I can give you cost of living adjustment March, April, May, and June. And I want to apologize for not being able to do the entire year, but by state law, my hands are tied. With that, before I give it to Rick, please visit birminghamal.gov/stay-at-home. Again, that's birminghamal.gov/stay-at-home. And check out some of our family activity guides, which include resources for health and wellness, among many other things. Now, I've asked my team members to join me on this call a little later, but for now, I'll turn it over to Rick, and we can begin our questions and answers.
Thank you, Mayor. And a reminder to everybody once again, just to be clear on how you can answer or ask a question during this to get your answers. Many people are already calling in. Press 7 on your dial pad. Once you press 7 on your dial pad, you will immediately be connected with a screener who will take your question, put it into the monitor so we can provide an answer to you. Just to let you know, among those who will be on the call, we also have a representative from the Jefferson County Department of Health, Dr. Wes Williford, who will be able to provide a status of the pandemic at this time in Jefferson County and answer any of the medical questions you may have as well. We will ask a question, and actually we're going to move on to that. We'll open up with a question that we have for you, and if you will respond, we'll tell you how to respond to this. Our question, should the City of Birmingham open on May 1st? Once again, should the City of Birmingham open on May 1st? Press 1 for no, not at all. Press 2 for yes, all the way. Press 3 for yes, but slowly. Once again, should the City of Birmingham open on May 1st? Press 1 for no, not at all. Press 2 for yes, all the way. Press 3 for yes, but slowly. We will keep this question open for about 2 or 3 minutes, and then we will close it and move to another question momentarily, but we do want to get your feedback. With that, let's begin with our very first question in this call. What will happen when the city opens back up on the 30th? Is it safe, and why isn't everyone required to wear PPE? Just again to point out, when it says this is the person's question, what will happen when the city opens up on the 30th? That is when this particular stay-at-home ends. That does not necessarily mean that changes happen at that time. I wanted to point out that's the questioner's words and not ours. So, Mayor, that's our first question.
So the current stay-at-home order expires, I want to say, I guess 11:59, April 30th, 11:59 p.m., April 30th. And so this order would be null and void today, starting May 1st. But we're not sure. I want to be very open and honest with you. I'm not sure if the city is ready to extend the stay-at order or lift it May 1st. We're 8 days away, and I know that may seem short for some on this phone. It may seem long for others on this call. But I think it's important as elected officials that we continue to speak with the Jefferson County Health Department, and any decision we make on either to extend it or lift it needs to be consistent with information we're receiving that says the number of symptoms are down, the number of cases are down, and our hospitalization as it relates to those being admitted and or needing a ventilator is down. All indicators right now seem to be, as it relates to hospitalization, that is flattened. It hasn't increased. In addition to that, those that are needing ventilators has decreased as well. But I think we're still assessing what happens after April 30th. And what I can communicate to you all is I believe a lot of things can be answered by the close of this week, and we'll be in a better position next week to answer the first part of this question, which is what will happen when the city opens back up. I can tell you we'll be looking at phasing in folk from teleworking in May. It probably will not be everybody. There are many other things to consider, so let us take some time to continue to work that out internally with HR, externally with the health experts, and we'll be in a position to better answer that. I have Dr. Williford on the phone, but before he responds to this question, the second part of the question is, why isn't everybody wearing PPE? I visited the police headquarters this morning, and that question was asked to me in person. There were 2 employees, probably less than 6 feet, talking to each other. They both had a mask, some type of face covering, but they weren't wearing it. And what I suggested to them is this: if you're sitting at your desk on your place of employment and no one's around you, then it's probably okay for you not to necessarily have it. But if you're in someone's presence and you're communicating with them, then you probably should wear it. Every employee is not required to wear PPE. Let me repeat that. Every employee is not required to wear some form of PPE. But I think we could see some either in suggestion, recommendation, or mandatory that everyone move towards some form of face covering. Face covering is not the same as PPE because everyone is not required to or needs to wear some form of an N95 mask. So we can have more discussion about that, I imagine, at some point next week. But the short answer to that question, because everyone's not required to.
All right, thank you, Mayor. Our next question, what's in place to ensure employees are safe once or when the city reopens?
So if we're referring to the city being open, I guess we're talking about city facilities. The things that are currently in place will remain in place for a little while. I think you all will continue to see our own internal teams, the way we clean surface areas, doors, elevators, buttons, I guess the turning on and off of the light switch, et cetera, if we are actually still using that, and other ways of how we clean internally. The external cleaning is set to expire end of May, but we're extending it. We're going to extend our external third-party contractor that does our deep cleaning, so that will continue as well. I think definitely for the month of May, you'll continue to see us keep doors open. We believe that the less touching of doorknobs or door handles, there's less spread because everyone is not making contact with the actual door. So this whole idea of keeping doors open the way we've done at the end of March and all of April, that will continue in May as well. And you'll find us doing other ways of making sure we clean surface areas. I believe the other thing that will be important is some form of a face cover. Again, face cover doesn't mean PPE in the form of everyone having to wear an N95 mask. And Dr. Williford's on the phone. He can address and give you all some more detail. And
if I can jump in on this, Mayor, Dr. Williford, this is an update since we all as a group talked previously. Dr. Wilson, the health officer yesterday, in fact, did put a public health recommendation about the mask. So some people may get a little confused whether that's a requirement or what that exactly means. So if you can share a little bit on the importance of coverings and what the recommendation means.
Sure. Thank you all for giving me the opportunity to speak. So I want to start off by saying, Dr. Wilson did issue a recommendation yesterday for the use of a face covering when you're outside of the home, or in particular working environments if you're with people around you. And again, the reasoning for this is more so to do with you protecting those around you more so than the protection that you get from the face covering. The idea behind it is that the face covering, if you were to cough, if you were to sneeze, if there was something that caused you to sort of breathe out and have the particles that the virus spreads by, that mask or face covering is meant to prevent the spread or decrease the spread of the virus. So really, wearing that mask is your way of showing your affection and your care for those around you, because it will prevent you from spreading it as easily as you would normally. And that's something that, again, it's not a requirement, but it is a recommendation that people consider doing that. And again, this can be something as simple as a cloth face covering, because, again, it's meant to decrease the spread more so than it is meant to prevent you totally from acquiring it. So, like I said, any sort of cloth face covering that completely covers your mouth is really acceptable.
All right, thank you, Dr. Williford. I'm going to remind everybody of the current question where we can close this one out and go to our next question. The current question is, should the city of Birmingham open on May 1st? Press 1 for no, not at all. Press 2 for yes, all the way. Press 3 for yes, but slowly. If you have not answered, this is your last call to answer. I'll give it about 15 more seconds, and then we will close this one out. So let's move to our next question from employees. Our next question, are any employees getting furloughed?
All right. So I'm going to try to explain this as direct as I can. city of Birmingham has a heavy dependence. Well, let me first explain the ways the city of Birmingham collects revenue. We collect revenue in the form of sales tax, occupational tax, business license, use tax, what I would define as fees. So that's permit fees and other forms of fees. And then the sixth way is ad valorem property tax. So that's a minimum of 6 different ways we collect money. The business license, the occupational tax, the sales tax, and the use tax, and lodging tax. So that's 7 actually. Majority of those make up about a little over 80 cents of every dollar that comes into the city of Birmingham. Right now, for the last 2 weeks of March and the 3 weeks of April we've been in, we have taken a significant hit on sales tax, use tax, lodging tax, and because of that, we're not in a position yet to determine the tough decisions we will have to make. But we will have to make some tough decisions. Now, for every dollar that comes in, for every dollar that goes back out, 70 cents of that is spent on our employees. And so there are things we will look to before we define break glass here. Break glass here would be the furlough, which is what the question was. I have no intention or desire to furlough any employees, but there probably will be other aspects as it relates to our employees. We will have to entertain and or address and or make hard and tough, unpopular decisions, but that will be in the spirit to keep everyone employed. Every decision I will make, the top line will be to make sure every employee can remain employed. But if you're still 70 cents of every dollar that goes out, I imagine some things will have to be different for the upcoming fiscal year that is supposed to start July 1. Knowing that, we're supposed to submit to the city council a budget by a certain date in May. I believe it's mid-May. But we may not be in a position to do that now because there's so much uncertainty and unknowns as it relates to how we will be able to allocate and submit a tangible budget, not knowing how hard we're hit with those certain taxes we're losing.
Thank you, Mayor. Before we go to our next question from the callers, I do want to open up our next question that we would like to ask you. Are you currently wearing face coverings when you leave your home? Again, are you currently wearing face coverings when you leave your home? Press 1 for yes, press 2 for no. Once again, are you currently wearing face coverings when you leave your home? Press 1 for yes, press 2 for no. We will keep this question period open for about 3 minutes, and then we will let you know just before we close it out. Mayor, our next question regards vacation time. The caller says right now there is nowhere to go, and we can only build up 320 vacation hours. By year end, if we are in excessive vacation time, can it roll over into sick time or some other time so it isn't lost? If the city has already budgeted for it, it shouldn't be a huge loss.
Well, so I'm going to start the answer off. And the answer is no, it can't roll over. Now, I would like for Ms. Madizik as much as she can to explain why it can't roll over.
So we are limited by the Personnel Board in the total amount of hours that can roll over from year to year. If we have too many employees who try to roll over hours that they're not able to take this year, then we end up in the same situation in the first 3 months of 2021. Therefore, even if employees are not able to go anywhere, we do encourage them to take their time off this year because they will not be able to carry over in excess of 320 hours.
All right, thank you, Ms. Madizik. Our next question regards hazard pay. When will it be in effect?
Next pay period.
So just for clarification, because some people may be asking, the hazard pay, if you've been identified as hazard pay, you are already being recognized for hazard pay. It won't appear on the paycheck until next pay period, correct?
That is correct. All of those individuals who will receive hazard pay at this point have already been determined.
All right, our next question also deals with hazard pay. Can you explain why landfill workers do not receive hazard pay when garbage workers do? We also have to deal with garbage as well, interact with citizens when they come to dump.
This is Joe Medizic again. The landfill workers who are operating as HEOs, laborers, and CEOs should be receiving hazard pay. We will go back and double check the list. We did send it to the department directors and ask them to verify that all of the individuals in the department were included. So we will look into that, and if the individual who asked that question emails me or calls me at 254-2819, I will look them up in the system and see what the issue is.
All right, thank you, Ms. Medizic. Before we answer or ask our next question, let me close the current question, the current poll question out. Again, the question is, are you currently wearing face coverings when you leave your home? Press 1 for yes, press 2 for no. We're going to close this one out in about 15 seconds. With that, Dr. Williford with the Jefferson County Health Department, we have a question that I think you can address. I would like for you to join us on this one. Have the numbers we've looked at during quarantine come from testing or people who have been hospitalized due to COVID? Can you explain a little bit the reporting process?
Yeah, sure. That's a really good question. So with that, what happens is, so yes to all of the above. What happens is the first thing that we look at are the testing results, and all test results that are done throughout the state have to be reported directly to the Alabama Department of Public Health. It's what we call a 4-hour reportable disease. If it's positive, that means it has to be reported within 4 hours to ADPH. When they receive that in their computer system, that gets sent out electronically to each county that would be responsible for tracing and contacting the person who has a positive test. Once we get that, then we begin our contact tracing process. The other thing, so that's how we're able to keep track of the numbers that we have, and then we also work with the hospitals to understand like the number of patients that are currently admitted. So we're keeping a close eye on that to make sure that the hospitals are able to handle the capacity that comes at them. And then finally, we've also started working with the coroner to make sure that we're catching people who may have died due to COVID-19. And so with all those streams of information, that's how we're coming up with our numbers of cases and the numbers of deaths as well.
Hey, Dr. Williford, thank you. Let me ask one follow-up question, because I know I've heard that there may be some question publicly about this. Is it the case that Alabama Department of Public Health has kind of changed their reporting system on the number of deaths in the state? I think a lot of people have noticed that usually when the local media reports it, they'll show reported cases and confirmed cases, and that is being addressed to kind of streamline those numbers a little bit, and that may create some concern. Can you explain what that means exactly?
Sure, and if you'll give me just a sec, I'll kind of give you the detailed explanation. And what it is that the change has been basically to make sure that we're capturing the number of deaths due to COVID-19 as well as we can. We're trying to avoid having an apples versus oranges situation when we look at data across the country. The change has been made. We talked to the Alabama Department of Public Health to basically be as inclusive as possible to make sure that we're capturing what is actually going on with COVID-19. And the change, basically, instead of having our physicians review each case individually, we say that if a person has a death and had COVID-19 at the time of death, we're counting that as a COVID-19 death. And again, this is basically to assure that we have uniformity across the United States and make sure that all the numbers mean the same thing. That helps us to make sure that our data and that our information about COVID-19 is as correct as possible when we compare it to the rest of the country.
Thank you, Dr. Williford. Now let's go to additional questions here. Here's a question about the COLA. Considering the 1% COLA, since it's not retroactive due to state law, instead of 1% for the entire year, can it be 3% COLA, which would account for the entire year instead of 4 months?
No, the answer to that question is no. This is Kevin Moore. I serve as the Chief of Operations for Mayor Woodford. But that answer is no, because what you have to realize is the COLA is extended for the life of your employment.
All right, thank you, Chief Moore. Our next question, will employees working at Park and Recreation, truck drivers under pickup trash, be considered for hazard pay?
Unfortunately not.
Once again, just a reminder for everybody as well, you can go and you can look and see who has been identified for hazard pay. If you go to birminghamal.gov/COVID policy, that's COVID policy, one word. You can go there, and all of the communication the city has provided on all policies dealing with COVID-19 for employees is located there. The Tele-Town halls are located there. Also, a list of all job positions that are able to receive hazard pay, all listed there. So I want to refer you to that as a reference point as well. Another question on this same topic: were park board employees eligible for hazard pay?
This is Jill Medisek, and to provide some clarification to the mayor's prior response, Park and Rec employees who are providing services where they interact with the public or have been transitioned to another department to provide services have been considered and, if appropriate, have been given hazardous duty pay. Again, if you go to the website mentioned by Mr. Journey, there is a list by employee ID number that you can look yourself up and see whether you're designated to receive that pay.
And again, that is birminghamal.gov/COVID policy. Let's go to our next question. Why does the police department have to perform mandatory checks during the pandemic? It puts the police officers' health and safety at greater risk. I think I misspoke. It's why does the police department have to perform mandatory checkpoints during the pandemic during this time?
That's a really good question. There was a point of time where we suspended checkpoints. But we believe, due to other public safety concerns throughout the city, as it relates to crime in our city, it was important that we strike a balance. I'm reminded that police officers risk their lives every day, not just for COVID-19, but on a routine traffic stop, a person running a stop sign or a red light, our officer risks coming into contact with people every day. And so I think it's important that I am well aware that the police department has enough equipped PPE for officers. And what I've noticed is a lot of officers aren't using it. And so I want to encourage our officers, who it has been made available to you, please use your PPE when you're out engaging on your beat.
Thank you, Mayor. The next question for you, Mayor, are you looking at other avenues of revenues of income due to the loss suffered during the pandemic?
Yes, but everyone should know that, other ways of, creative ways of making money right now, we're limited because there's an economic crisis throughout the entire country. So everyone is experiencing the same pain. This is not unique to Birmingham. I will tell you, in an ideal world, hopefully other forms of how we collect money is good. The good news is we collect most of our business license revenue in the months of January and February, and so we collected that right before this hit. As many of you all know, construction is still going on, not just in Birmingham, but throughout the nation. So as it relates to permit fees and all those things, we hope that's increased. And then many of you all still have an appreciation for some form of shopping. So even if those sales tax are not outright in the store, hopefully it's increased online with use tax. But we'll be able to know more about that next week.
All right, thank you, Mayor. Our next question, which city buildings receive deep cleaning?
The city buildings that receive the deep cleaning are the city facilities that have the most interaction from the public. It's 5 of them. It includes City Hall, City Jail, the Police Administration Building, Police Precincts will begin within a week, and Municipal Court.
All right, thank you, Mayor. We continue to receive a lot of questions about hazard pay. This is kind of a broad question that I think would be good to address, so we're not repeating ourselves too much on this. Who is getting hazard pay, and why not if you do not receive hazard pay? If we can provide that general answer.
I'm going to have Ms. McDisaac answer this last question on hazard pay.
There are over 2,000 employees who have been designated for hazardous duty pay, for COVID-19 pay. We have captured the job descriptions for individuals who have regular direct contact with the public. We included as many job classifications as we could for the amount of money that was provided for that pay, as well as providing the directors an opportunity of each department to add employees that should be added. We recognize there may be individuals that do periodically have to interact with the public, but for those individuals, they do not qualify for the hazard COVID pay because it is not regular direct contact.
Thank you, Ms. Medizek. And once again, I want to remind everybody, if you are still not clear if you are receiving hazard pay or not, you can go to birminghammail.gov/COVID policy, COVID policy, and you will be able to go through based on employee identification number and job description. You will be able to go, or job title rather. You'll be able to go there and identify. We have a question, and I believe this concerns if more employees start coming back to city facilities in the coming weeks. Will city employees be required to be tested before returning to work?
This is Cedric, Chief of Staff. So employees will not be tested before returning to work, but we are reviewing ways that upon entrance into city facilities that we can continue to evaluate whether or not employees are showing signs or symptoms that warrant extra consideration. So no testing will not be required, but we will be very attentive to signs or symptoms that employees may be displaying to make sure we keep all of our employees in safe space.
If I may follow up on that as well, Dr. Williford, I know that a lot of people ask about testing in general throughout communities, not just here in Birmingham, but throughout the nation. Can you talk a little bit about the protocols that have typically been put in place in Jefferson County to address needs for testing? Who typically is getting testing and who is not?
Yeah, thank you. At this point, testing, much like throughout the rest of the United States, still remains constrained. We do have new labs coming online locally, and the existing labs are expanding their testing capacity by leaps and bounds, which we're very happy about. One of the things that still continues to be the case, and it's out of just pure practicality, is that the testing right now is kind of still being used for people who are exhibiting symptoms or for very, very high-risk groups that we're very concerned that could lead to a much larger outbreak. One of the things that eventually we want to be able to get to is so that we can either provide testing that at the point of basically much like we have a flu test that can give an answer very quickly. We hope to get there with COVID-19 at some point, but we're not there yet, and so that there still remains quite a need. And one of the roles that we're taking on here at the Jefferson County Department of Health is to help coordinate these efforts so that we're getting as many people tested as possible. But I will admit it's been a slow process, and I'm hoping that we continue to see progress going forward. I will say that, you know, as we expand this testing capacity, that is going to be the key to us being able to stay out of a lockdown situation like we're in now, is being able to test quickly. And I think that capacity is being built up each day, and I hope it continues to expand.
Dr. Williford, this is another question for you, and since you're unmuted, I thought it'd be a good time to ask it. This one says, initially we were asked not to wear face coverings. Please provide more clarity why the change. If the mask protects others from you, then isn't it true that the other ones wearing masks will also protect them from be protected?
That's a great point, and that's something that I was thinking about a little while ago, and I want to explain what the primary difference was. So very early on, when this started to become an issue in the United States, the guidance was made not to wear the masks or that the masks were not necessary early on. I think the big reason that we've seen a change is because we've seen a change in the virus. At that time, there's very limited amounts of virus in the United States. I was reviewing back over slides and data. The first death in the United States due to COVID-19 was on February 29th. I think that was 53 days ago. And so since then, a lot has changed. The virus is much more common in the community now. So because of that, because there's more virus, the risk of someone walking around and not having symptoms and potentially spreading the virus is higher than it was then. And I think that's another thing that we did not understand very well at that point when the original guidance was given, is that people are able to spread this virus with very minimal symptoms or with no symptoms at all. And so that's partly been due to a change in basically a gaining of understanding about how this virus works.
All right, thank you. Thank you, Dr. Williford, for those answers to those questions. We have got a couple of other elements that I want to introduce in the time that we have together. So we have another question for everybody on this line, another poll question. This deals with economic impact. Do you have a family member that has experienced job or business loss during this crisis? Press 1 for no, press 2 for no, but hours have been cut, and press 3 for yes, someone lost their job or business. Again, the question is, do you have a family member that has experienced job or business loss during the crisis? Press 1 for no. If you have answered it already, please answer it again. I pushed the open button a bit late. So press 1 for no, press 2 for no, but hours have been cut, and press 3 for yes, someone has lost their job or business. Finally, I'll ask again, do you have a family member that has experienced job or business loss during this crisis? We will keep this question open for about 3 minutes. While you answer this poll question, I would like to turn now to Tracy Bennett. She serves as Deputy Commissioner for the Office of Sports and Entertainment. She would like to join us now to update folks on health and wellness during this pandemic period, and she's got some information to provide for city employees.
Hello, everyone. During this time of COVID-19, a lot more people are at home, more than they would have been normally. So the city created a stay-at-home family activity guide. This guide contains 22 pages of information from multiple age groups. It covers elementary age youth, teens and tweens, adults, and seniors. About 5 or 6 departments came together to create this guide. And so for each of the age groups, it contains recommended activities in the categories of health and wellness, cultural arts, technology, education, and athletics and recreation. It also includes a sample schedule and links to resources like exercise videos, free music such as the mayor's stay-at-home playlist on Spotify, and free professional development links. So several people have reached out to us to learn about ways that they can be of service or to give back during this time. So we did include some recommendations in the guide for each of the age groups. So for children, you can visit page 7 to find ways to give back. And for adults, you can visit page 18 to find ways to give back. The entire guide can be found at www.birminghamal.gov/stay-at-home.
All right, thank you, Tracy, Ms. Bennett, for that. So once again, I'm going to remind you on this current question, do you have a family member that has experienced job or business loss during this crisis? Press 1 for no, press 2 for no, but hours have been cut, and press 3 for yes, someone lost their job or business. I'll close this question out in just a few minutes. Our next question from our callers: what would be the protocol for city employees who have tested positive and recovered but then will be coming back to work around other city employees? How can employees continue to protect themselves?
This is Joma Isaac, and we do have protocol established for when individuals have tested positive. The requirements are they must have finished their mandatory 14-day quarantine period. They also have to have been free of fever of 100 or above for 3 days without any fever-reducing medicine, They need to be free of other symptoms. Additionally, the other option is for that individual to have 2 negative tests within a 24-hour period, and those protocols are what has been established by the CDC and is being used by our fire department as well, relating to the healthcare workers, and we are following similar guidelines to continue to protect our employees.
I want to add to what Ms. Cedric has said, everyone. Part of the question was a very straightforward question. How can I protect myself? I'm going to tell you one of the best ways you can protect yourself. I have not actually shaken someone's hand at this point, probably in 5, maybe close to 6 weeks now. I want to encourage you, when you're engaging your colleagues, if it's not a person that lives in your household, you probably shouldn't make any form of physical contact. So I wouldn't say it's time to start hugging, shaking hands, high-fiving your colleagues. I would still pause on those type of things. Even if we want to do it, I would recommend not doing it. The CDC has also had a recommendation as it relates to wearing some form of a face cover. Again, a face cover does not mean a N95 mask. It just means any form of covering for your face. I would recommend that. So I would take the CDC's recommendation when you're out of your home, if you're not exercising, if you are at work or you're at a grocery store, you're at a gas station or wherever you are, if it's not your home, you should be wearing some form of a face cover.
All right, thank you, Mayor. I've got several questions dealing with once the city begins expanding more employees coming back. This is one of those questions. How will the 6 feet distance be maintained once employees do return to work?
In some instances, 6 feet won't. It's not realistic. That's why the CDC's recommendations and guidelines are to wear a form of a face cover. So even if you have to engage a colleague, think about this for a second. You walk into your office. You walk into your floor. We have thought about everything. We put a hand sanitizer inside and outside of the elevator. We are constantly cleaning door handles and doorknobs. As it relates to your workspace, if you can't maintain 6 feet, it then becomes this. If a person is around talking or talking to you, whether they're talking, singing, laughing, coughing, sneezing, the whole idea of a face cover is so the person can't necessarily share or spread anything, particles, from them to you. So, again, the biggest thing you can do is, at this point, take the CDC's guidelines and recommendations, because 6 feet will not be the rule when everything opens back up. The rule will be, at a certain point, probably going from recommending face covers to probably having to enforce some form of a face cover. But in the meantime, just take the recommendation and cover your face.
Again, this is another back-to-work type of question. Some of us will not be physically able to go to work because of extenuating circumstances, child care issues, taking care of elderly family, etc. What steps should we take when it comes to reopening the economy or reopening city facilities on a broader basis?
So again, this is Cedric, Chief of Staff, and there are a couple of considerations. We recognize that not only child care, but there are some family members who are caregivers for other members of their family as well, whether it's parents or grandparents. A part of what the mayor is considering is a phasing in of city employees to allow time for those family members who do serve as caregivers to have as little burden on them as possible with regards to the transition until services are opened up more in the community. So just know that there are considerations being made and plans are being made to, one, assist the departments with the phasing in of those staff members, as well as providing options via the city of Birmingham to provide support for family members who serve as caregivers, especially those who are caregivers of children.
Thank you, Chief Sparks. Our next question, could you repeat the COVID-19 website again? I believe the one you were referring to deals with city employees. It is birminghamal.gov/COVID policy. That's COVID policy. We also have birminghamal.gov/coronavirus, which is a general information for the city of Birmingham provided throughout the city. And I'll turn to Tracy Bennett. Ms. Bennett is with the Office of Sports and Entertainment as far as health and wellness and other resources that we have. What others do you recommend that city employees may want to turn to? And I'm sorry, I got it in front of me. That's the stay-at-home, birminghamal.gov/stay-at-home. Sorry about that. I'm looking at it and I'm asking you. birminghamal.gov/stay-at-home is where you have activities information as well as health and wellness information as well. Again, there are several questions that deal with reopening. This one is very, very specific business. When will municipal court reopen? I think Mayor, it might be important to share with everybody that there is not a set plan. I mean, there is not a set announcement as far as a date at this time to reopen.
Yeah, we're working on that, everyone. We do not have a set date when it will reopen. But what I'm committing to the employees is that you will have ample notice before it's reopened.
This is a question. Is there a plan in place where at any point employees' temperatures will be checked when they enter city facilities?
I think that's dependent on the department and or unit and team. There's some current teams and current departments that are already doing this. But as it relates to other departments, that will need to be assessed.
Our next question, what procedure will be in place for town hall meetings, neighborhood meetings, and other community meetings in the future?
That procedure has not been determined as of today.
And I think it's important to point out also, I'll mention this, Mayor, is that this is one of those conversations that you pointed out often, is that you were working very closely and your team is working very closely with Jefferson County Department of Health to make those types of decisions moving forward as we decide what the new normal will be.
That's correct.
Let me just stand by for a moment as I move to a next question. Another question about employees, potential issues that some employees may have if they're currently working from home but are called back in. What about employees with underlying medical conditions and with recommendations from a doctor not to return to work?
This is a conversation that I know HR is having. They're discussing, they're assessing, and they'll be making recommendations to us sooner than later so we can share them with all of our employees.
So let me stand by 1 second as I get to my next question. Bear with me 1 second. My computer's lagged up right now. Again, this is a question about reopen. When employees return, how much notice will be given?
I imagine a minimum of 1 week.
This is a question that we had earlier, but it is multiple parts of it. Will all essential employees be tested before returning to work? Will temperatures be taken before returning? Is there a plan for people who are positive but are asymptomatic?
Number one, the answer is no. Number two, will temperatures be taken? Again, that's being assessed, and that depends on what department. And the third question, I believe the answer to that is no as well.
All right, stand by for 1 second as we move on. Actually, if I can, Dr. Williford, I believe, is still on the line. I see him. I'd like to ask Dr. Williford, because we do have a lot of questions about testing. I know you discussed it earlier. Some people are asking about folks who are asymptomatic who may not think they have it and likely would not be tested. How can the community ensure that there's no spread that way? Can you discuss that on a broader level?
Yeah, that's great, because I think as the questioner is suggesting that we do have people who do not have very, 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 very mild symptoms or no symptoms at all and could have potentially been infected. So the best things that we can do in the community to limit the spread that those people might have is one, of course, obviously, closely monitor yourself for symptoms. If you're not feeling well, you need to have a very low threshold to say, oh, maybe I need to stay back or hold out to avoid contact with people. But then the other things that we've talked about are very important as well. So the face coverings. If you are asymptomatic or you're not, that's why if you're not having symptoms, that's why those face coverings are important. It's because it's meant to block or decrease the spread for people who have maybe not yet have developed symptoms. And then, of course, the standard things, making sure that you're aggressively washing your hands multiple times a day, making sure that you're trying to clean off your hands after touching doorknobs or commonly used surfaces, and just making sure that, you are doing everything you can to limit your contact with other people. Those will be the most key things to keep from spreading virus, even if you're not having symptoms. And that's, again, where we come back to the notion of social distancing. If the virus is not able to contact another person, then the virus is not going to spread further. And so everything that we do to avoid contact, to keep ourselves very clean, and to prevent the spread of droplets with a face covering, those are the best mechanisms we have to prevent further spread of the virus under any circumstances.
Thank you, Dr. Williford. Okay, we have a question from Park and Rec. We've gotten actually several questions on this topic from Park and Recreation. Will Park and Rec go to a 4-day, 10-hour shift to limit exposure?
Park and Rec will not be going to a 410. We have 32 departments and divisions across the city. I want to repeat that. We have 32. And today, only 2 of those 32 departments are in 410s. That is police, and that is public works. At this point in time, during the coronavirus, there will be no other departments going to 410s of the total 32.
And just to mention to everybody, if you're still on the line, we have a considerable number of folks on. We do have a good number of questions. We're trying to get through as quickly as possible. We are past the time that we typically run, but we're going to continue to ask a few more questions. So we're extending this call slightly so we can address a few more questions. Our next one: why hasn't the library been included in the deep cleanings?
Because all of our libraries are closed.
Okay, stand by 1 second as we. Will the city provide mask or face coverings when employees return?
If the city, so that can answer that 2 ways. So actually it's 3 different ways to answer this question, because I want to be very consistent in what I'm saying. There's certain departments, based on the type of work they do, of being possibly exposed to people in the community. PPE has been purchased and has been provided to those departments. Those employees on this call know who you work for in those departments. There are 2 other ways to look at this. One is under the current CDC guidelines and recommendations. 2 weeks have existed where they have made recommendations. If you walk out of your home, it is recommended you wear some form of a face covering. It doesn't say PPE, it just says face covering. That can be a bandana, it can be a T-shirt, it can be anything. So I have encouraged our residents and of our employees to take the recommendations. The third way to answer this: if we as a city do move towards a temporary practice making it mandatory, then we'll need to assess if the city is going to pay for it or not.
All right, thank you, Mayor. This is a question specific to one department from 911 communications workers. Why do we not have hand sanitizer in the hallway in the basement?
Well, I'll work on that. Let's get you some hand sanitizer.
We also, and if I may, I'll just go in and answer this question because I know we've responded to this earlier. When will we receive hazard pay? If you qualify for hazard pay will appear on your next pay period. It will appear on your next pay period check. Working through our questions here, just one moment. Bear with me one moment. Getting a number of questions about hazard pay. I just want to restate, if you have questions about who's receiving and who's not, you can go to birminghamal.gov/COVID pay, That's birminghamal.gov/COVID-pay. That's COVID-ID, not COVID-pay, it's COVID policy, birminghamal.gov/COVID policy. That's COVID-policy, one word, and you will be able to find information on the COVID-19 pay listed on that, along with other communications the city has provided for its employees. Stand by one moment while we pull up the next question. Can the city mandate everyone entering buildings to wear masks or face covers? That would include businesses, employees, and residents that are coming into the building.
As of today, we can recommend it. I think we have shared with the legal department to assess, investigate, and see if we can move towards that. But that we have not received. We've received some recommendations. We need to go over what we can and can't do as it relates to that. I can tell you, even if we did move to enforcement of face coverings, there will have to be recommendations. There will have to be exceptions to that. The health department will easily tell you some people have underlying health issues that by wearing a face cover, that it actually limits their ability, limits their oxygen. So there are other exceptions as well. So, we will continue. I'm committing to you all that the conversation around face covering started 2 weeks ago. We continue to look over this issue. As of now, please take the CDC's recommendation to wear a face cover if you leave your home.
If the city reopens, or when the city reopens, is there a plan to reduce restrictions on child care? Many of us do not have access to child care. Are there any considerations?
So unfortunately, that is not our determination. That is the determination of the county.
I have a question for Dr. Williford. We have him just for a few more minutes. Dr. Williford, there was a question about the strains of COVID, of coronavirus, in particular dealing with this pandemic. We have people asking, are there multiple strains, and are some worse, and is it more than one strain that we're dealing with in this pandemic at this time?
Yeah, so I think at this point we're still largely dealing with the same strain. They may the viruses that circulate may differ very, very slightly, but not like with the flu. So the flu has very distinctly different strains that circulate each year. That's why when we get a flu shot, it often contains 4 different varieties of the flu because each one acts a little bit differently in our immune system. But by and large, what we're seeing and what the understanding is right now, that the COVID-19 that's circulating is all largely very similar to each other, and it doesn't have the strains like influenza does.
Thank you, Dr. Williford. Our next question, just to let you know, we've extended the time on this call. We're going to wrap up with this question here. Then the mayor will have some closing comments. And a reminder to you before the mayor closes this call, I just want to remind you, if you have additional questions that have not been addressed, you can press 7. You can still file your question, and we will review and try to put out additional information on that. Also, this call is recorded, and it will be posted on 2 places, birminghamal.gov/coronavirus or birminghamal.gov/COVID policy. COVID policy is the location where city employee communications is being posted after we send out emails and policies. Also, information about hazard pay is located there. So we will remind you again after the mayor's closing comments. But with that, our last question for this call, Mayor, is non-essential workers were originally at home but now are being asked to come into work. Why are non-essential employees asked to come without having tasks to perform and a lack of proper sanitary items?
Good afternoon. This is Kevin Moore again, Chief of Operations. Non-essential employees were designated early on, but if there's an act to reopen the city of Birmingham, everyone will come in because we do have tasks and duties for everyone to perform.
This is Cedric, Chief of Staff. In addition to that, the goal was to reduce the amount of exposure for as many employees as possible. So the designation for non-essential employees to go home was again meant for as many employees' protection as possible. However, city services continued. So if employees were brought back in, it's because there were tasks that needed to be identified, even if they were not readily aware to the employee who was being brought back in. In the event that an employee returns and feels that they have not received the necessary equipment because each department has been outfitted with the necessary protection equipment, please make sure you lift that up to your director, who will lift that up to Chief Moore and myself to ensure that you are as well protected as possible.
All right, thank you, Chief Sparks and Chief Moore. And with that, that concludes our questions. Mayor Woodfin will have closing statements, and then I'll remind you once again how you can follow up to re-listen to this call or refer it to others who may not be able to join us on this call. Mayor?
Again, I want to thank you all for being on this call. I want to thank Ms. Tracy Bennett for the presentation, as well as Dr. Williford for always being with us, taking the time out of his busy schedule. To the employees, please go back and share this with your colleague who couldn't be on this call about some of the things we've discussed today. As always, thank you for your service and continuing to put people first. I want to remind you all to follow the CDC's recommendations and guidelines, as well as the recommendations and guidelines we have before you. We will continue to do everything to provide for you, while you continue to do everything to provide for our citizens. Everyone have a good day and be safe.
Thank you, Mayor. That concludes our phone call with Mayor Woodfin for city employees. Once again, a reminder for you, if you still have a question that has not been responded to, you can press 7. Our screeners will notate that question so that we can plug that in and see how we can further address those requests. In addition, you can go to birminghamal.gov/coronavirus or birminghamal.gov/COVID-policy to find a link to the audio. It won't be up immediately. It is a fairly large upload for us, but we should have within the next hour or so, we should have this call posted there along with all the others. Again, echoing what the mayor said, thank you for your service and thank you for your commitment to our city. Have a good day.